Dr. Michael, I've often heard you talk about the elephant in the room when it comes to the coronavirus. What is it you're referring to?
I'm from Africa, so elephants are a big topic for me. Elephant in the room with the coronavirus. The elephant is the fact that there is so much focus on hand washing, on touch, and on social distancing, and virtually zero, starting to end, on aerosols. And the problem with ignoring aerosols, in other words, those fine droplets that we express when we clear our throat, when we maybe have a dry cough, when we're talking, we are continuously sending out aerosols. Nobody's dealing with aerosols because they are invisible, and we feel that if we are safe at a distance, we don't touch anything, we're not going to get sick. But James, think about this. If this coronavirus had gone from China all over the world in 4 months simply by human touch, it would be beyond probability and conception that everybody had touched something. E. coli is a bacterium that is spread through touch. If somebody in China has E. coli and it spreads out into a local village or community, the chances of it spreading around the world through touch is virtually zero. It'll be localized, maybe go a few villages left and right at maximum. But we're dealing with something that has gone global in 4 months. These are respiratory viruses, and they spread around the world rapidly. Why? Not because we're sneezing on each other or coughing on each other, because we're simply breathing. We are standing in a place, breathing these viruses in and out, moving to a new place, somebody comes into our space, and this is how it goes around the world like wildfire. So the elephant in the room is that we need to be talking about mitigating aerosols. The mitigation of aerosols is possible, but it requires direct discussion on aerosol mitigation. The same way dust floating in the air, if there was asbestos floating around in this room, we would be discussing mitigation of asbestos in the air, and we'd use ventilation to do that, and sucking it out and filtering it out. That same discussion is what we need to have for the coronavirus. Why? If you take the Spanish flu as an example, this was Christmas. The peak occurred in the latter half of the winter. It went down, exactly what we're seeing now. And then it went into a horrific second wave. Look at the history. We are running the risk, James, that we get through the summer, we feel everything's over, the economy's back to normal, and then the winter comes in, we start closing indoors, we start huddling again, and we get the second wave. And the second wave potentially could be bigger than the first wave, because now it's starting at the beginning of winter. And the way this is going to propagate is again through aerosols. Sick people breathing out germ-filled air. I'm using the word germ now. These are viruses. These are small particles that if they get into your lungs, they will infect you. And we want to make sure that this rate of rise isn't so steep. It will shut the economy down again. The elephant in the room is aerosols, and nobody's talking about them.